Welcome, class, to today's lecture on neurology. Today, we will be delving into the fascinating and complex world of brain tumors. Brain tumors are abnormal growths of cells that multiply and form a mass inside the brain. While there are various types of brain tumors, each with their own unique characteristics, our focus today will be on some of the most common and significant brain tumor types. Let us begin with one of the most aggressive and lethal brain tumors, known as glioblastoma multiforme, GBM. GBM originates from astrocytes, which are a type of glial cell in the brain. These tumors are characterized by their invasive nature, rapid growth, and resistance to treatment. The exact causes of GBM are still not fully understood, but potential risk factors include advanced age, exposure to ionizing radiation, and certain genetic mutations. Moving on, we will now discuss meningiomas, which are typically slow-growing tumors that arise from the meninges, the protective membranes covering the brain and spinal cord. Meningiomas can arise from different subtypes of cells within the meninges and can exhibit a wide range of behaviors and symptoms. While most meningiomas are benign, some may become malignant over time. Common treatment options for meningiomas include surgery, radiation therapy, and targeted drug therapies. Next, we turn our attention to brain metastasis, which refers to the spread of cancer cells from other parts of the body to the brain. Brain metastases are more common than primary brain tumors. They often occur in individuals with a history of cancer, most commonly from lung, breast, or skin cancers. Symptoms of brain metastasis can vary depending on the location and size of the tumor, and treatment options may include surgery, radiation therapy, and systemic therapies. Now, let's shift our focus to brain tumors that specifically affect the pediatric population. These tumors can be challenging to diagnose and treat due to their unique characteristics and the delicate nature of the developing brain. Pediatric brain tumors encompass a diverse group of tumors, including medulloblastoma, gliomas, ependymomas, and embryonal tumors. Treatment options for pediatric brain tumors often involve a multidisciplinary approach, including surgery, radiation therapy, and chemotherapy. Moving forward, we will explore neurofibromatosis type 2, NF2, which is a genetic disorder characterized by the development of multiple tumors in the central nervous system, particularly in the brain and spinal cord. The most common tumor associated with NF2 is the vestibular schwannoma, also known as an acoustic neuroma. These tumors arise from Schwann cells and typically affect the 8th cranial nerve, leading to hearing loss and balance problems. Treatment options for NF2 vary depending on the extent and location of the tumors but may include surgery, radiation therapy, and targeted drug therapies. Now, let's shift our focus to pituitary adenomas, which are benign tumors that develop in the pituitary gland. The pituitary gland is responsible for producing and regulating various hormones in the body. Pituitary adenomas can lead to an overproduction or underproduction of hormones, causing a multitude of symptoms depending on the affected hormone. Treatment options for pituitary adenomas may include surgery, medication, and radiation therapy. Moving on, we will now discuss medulloblastoma, which is the most common malignant brain tumor in children. Medulloblastomas typically arise in the cerebellum, which is responsible for balance and coordination. These tumors can rapidly spread to other parts of the central nervous system. Treatment for medulloblastoma often involves a combination of surgery, radiation therapy, and chemotherapy, tailored to the individual patient's risk factors and molecular subtype. Now, let's delve into primary central nervous system lymphoma, PCNSL, which is an uncommon type of brain tumor associated with lymphomas. PCNSL can occur in individuals with compromised immune systems, such as those with HIV/AIDS or organ transplant recipients. The treatment approach for PCNSL typically involves a combination of high-dose chemotherapy, radiation therapy, and targeted drug therapies. Next, we will explore the genetics of infiltrating gliomas, a group of brain tumors that arise from glial cells. Understanding the genetic alterations in these tumors is crucial for tailoring effective treatment strategies. Recent advancements in molecular profiling techniques have revealed specific genetic mutations and alterations associated with different subtypes of gliomas. These findings have paved the way for targeted therapies and personalized medicine in the management of glioma patients. Shifting gears, we will now focus specifically on acoustic neuroma, also known as vestibular schwannoma. As mentioned earlier, these tumors arise from Schwann cells and typically affect the vestibular nerve, which is involved in hearing and balance. Symptoms of acoustic neuroma may include hearing loss, tinnitus, dizziness, and imbalance. Treatment options for acoustic neuroma include observation, surgery, and radiation therapy. Moving on, let us explore the role of radiation therapy in the treatment of brain tumors. Radiation therapy uses high-energy beams to target and kill cancer cells. It can be employed as a standalone treatment or in combination with surgery and chemotherapy. The precise delivery of radiation therapy, such as stereotactic radiosurgery, allows for targeted destruction of tumor cells while minimizing damage to surrounding healthy tissues. Lastly, we will discuss the role of neuroimaging biomarkers in the diagnosis and management of gliomas. Advances in neuroimaging techniques, such as magnetic resonance imaging, MRI, and positron emission tomography, PET, have revolutionized our ability to visualize and characterize brain tumors. Neuroimaging biomarkers can provide valuable information regarding tumor location, size, shape, and response to treatment. These biomarkers aid in treatment planning, monitoring treatment response, and assessing disease progression. In conclusion, brain tumors represent a complex and diverse group of diseases that require a multidisciplinary approach for diagnosis and treatment. Today, we have explored various brain tumor types, including glioblastoma multiforme, meningioma subtypes, brain metastasis, pediatric brain tumors, neurofibromatosis type 2, pituitary adenomas, medulloblastoma, primary central nervous system lymphoma, infiltrating glioma genetics, acoustic neuroma, radiation therapy for brain tumors, and neuroimaging biomarkers in glioma. The field of neurology continues to advance, offering hope for improved outcomes and the development of novel therapies for patients with brain tumors.